Na mtazamaji, awali wakati tukianza kipindi hiki nilikuarifu kwamba tutakuwa tunakupeleka kwenye matukio ya moja kwa moja kongamano la kitaifa kuhusiana na ugonjwa wa saratani likiwa linaendelea katika mtaa wa South B, kongamano ambalo ni la kitaifa, mwenyeji akiwa ni NCI maarufu National Cancer Institute, na mgeni wa heshima akiwa ni mkuu wa mawaziri Musalia Mudavadi pamoja na waziri wa afya Aden Duale katika kongamano hilo ambalo linaanza leo mpaka siku ya Jumatano. Tuende moja kwa moja katika matukio hayo mpaka mwendo wa saa 6 na dakika 55 hivi pengine, wakati kongamano hilo litakuwa linafikia kikomo kwa leo, wakati wa kutoa moja kwa moja matukio yanayoendelea. Tusikilize.
Kokoliko koko kakuku kalari ranga koko aya mama koko aya mama koko aya mama koko aya mama
Let us give a standing ovation to KSG Choir for such a beautiful, beautiful performance. Let's give them a standing ovation. Thank you so very much indeed. You may take your position. We shall call you during the next performance. Ladies and gentlemen, I just want to remind you that our chief guest, the Prime Cabinet Secretary, is within the building. He's going through this, the various booths, and he should be joining us shortly. I want to invite on stage the Cancer Champions Choir. You can do better than that. Okay, let me repeat. I'm about to invite the Cancer Champions Choir. Oh yes, please let them come on stage and sing for us. Thank you.
Good morning. Good morning. Yes, my name is Lucy Jerry, and I'm a very big noise maker in the cancer space. Because one, I got a diagnosis. Secondly, doctor in the room, Asante. It's because of you, that's why we are standing here. Thank you so much. And plus the pharmaceutical companies for manufacturing the drugs. Thank you so much. Ndio tunameza. Cancer survivors, please. Our scars make us unique and beautiful. I don't want to call you by names. Cancer survivors, cancer champions, thrivers. Hey, Dr. Nashat is one of us nowadays. Karibu. We are going to dance here. Marine. And caregivers. Janice. Please come. I'm not coming for you. Please come. Nimekuja kusema asante. Churchill. Joanne. Hey. Mwende Motiso. Alela.
Asante kwa wema wako na fadhili zako Baba.
Tumekuja kusema Cindy.
Mimi nimekuja kusema asante.
Our caregivers, please come. Our caregivers, please come.
Ladies and gentlemen, let's kindly be upstanding to welcome the Prime Cabinet Secretary, His Excellency Musalia Mudavadi, together with his team, as we continue to be entertained by the Cancer Champions Choir.
Asante, asante. Tumekuja kusema asante.
Let's join the Cancer Champions Choir in singing this beautiful song as we come to say thank you during this second national.
Nimekuja kusema asante.
Moyo wangu wa shukuru, nafsi yangu ya kuhimidi Baba.
Nimekuja kusema asante. Nimekuja kusema asante. 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 Nimekuja kusema asante. Asante. Asante.
Thank you so much.
Asante. Asante.
Nimekuja
kusema asante. Thank you so much, choir. Asante sana. That's a beautiful song.
Thank you so much. Those are the cancer survivors, cancer champion, cancer thrivers. Please come back. Please come back. In Ashiria, this is a show of treatment is working. Early detection saves life. And our doctors are up to task. Nobody has gone for treatment outside Kenya. Most of us here have got our treatment either in KNH, KU, TR8, Jaramogi, Oginga. So, big up people. Thank you so much. And Mama Kisumu is a witness to that. Our only plea, our only ask before we sit down, access to medicine. Our only plea.
Thank you.
And another thing, please, the radiotherapy machine. The backlog at KU and at KNH.
Asante
We
sana.
want to have a bigger number next time. Thank you so much.
Thank
Asante
you
sana.
so
Let's
much.
give our hands together to the Kansa Champions Choir.
And as we remain upstanding and transition into the high-level session, kindly let's have the national anthem and the East African anthem.
Nguvu yetu.
Afrika Mashariki, tuwezeshe kuishi kwa amani, tutimize na malengo yetu. Jumuiya yetu sote tulilinde, tuajibike, tuimarike, umoja wetu ni nguzo yetu, idumu jumuiya yetu.
Asanteni sana. Please let's be seated. And we now want to call on stage Dr. Elias Meli, the CEO of the National Cancer Institute of Kenya, tumpigie makofi as we kick off the opening ceremony. Karibu.
Thank you very much. And as he comes to stage, the KSG Choir, please do that one item and third to welcome the CEO.
Umbomizi bora wa mama abavangu ndayanza. 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 Zibora Obomi msalia karibi angala ucheze kidogo salia obomi msalia karima aba obomi gavana karibi aba bangunda yanza wana obomi gavana wa mama gavana karibu baba aba bangunda yanza ogomi duale wetu aba bangunda yanza duale ogomi duale wa mama egonga biswa zibora gonga biswa zibora gonga biswa egonga biswa msada gonga biswa egonga biswa msada gonga biswa egonga biswa namabeka gonga biswa gonga biswa gavana wetu gonga biswa eduale ho ongera kwako baba tunakuona unang'arang'ara ongera msalia Mungu akuongoze baba ongera gavana wetu ongera gavana wetu shwa Thank you.
Thank you very much indeed. Let's put our hands together for the KSG Choir as we put our hands together as well to welcome Dr. Meli, the acting CEO at National Cancer Institute of Kenya. Thank you very much. Welcome.
our chief guest for the second National Cancer Summit, His Excellency Dr. Musalia Mudavadi, our Cabinet Secretary of Health, Honorable Haden Duale, our board chair of the National Cancer Institute of Kenya, Council of Governors represented by our able Governor Anyang' Nyong'o, our PS Medical Services, PSS present, distinguished guests, ladies and gentlemen, you are all welcome to the National Cancer Summit. We are glad that you honored to participate in this meeting. His Excellency PCS, the National Cancer Institute of Kenya, and all the stakeholders under the leadership of our Cabinet Secretary, Ministry of Health, have brought together all the stakeholders in the entire cancer ecosystem within the country and without, who have been supporting the initiatives in this cancer space, working towards one vision, to have a cancer-free Kenya. Currently, we are burdened by rising cases of cancer, with over 44,000 new cases every year and more than 28,000 deaths every year. We're going straight into the program. We do recognize that our Prime Cabinet Secretary and our Cabinet Secretary of Health and all the distinguished guests who are here have a very busy schedule. Allow me at this point to ask us to listen to a 5 minutes short clip from one of our esteemed guests who could not make it because of unavoidable circumstances. And this is Dr. Julie Gralo, who is the Chief Medical Officer, American Society of Clinical Oncology, who has partnered with us in a lot of initiatives in the past. Media team, kindly.
Hello, I'm Dr. Julie Gralo, the Chief Medical Officer of the American Society of Clinical Oncology. I appreciate the invitation to speak at this important 2025 National Cancer Summit hosted by the NCI Kenya, and I'm so sorry that I can't be with you today. I understand your theme is uniting our voices and taking action, so I'd like to talk about how we might better unite our voices and take action together. We've been discussing this with the NCI Kenya for a while now. Over on the left, you'll see my visit to the offices of the NCI Kenya back at the end of 2024. And then the NCI Kenya staff, including Dr. Melly, joined us at our ASCO annual meeting in Chicago just this past June. I'll tell you a little bit about ASCO as an organization to set the background, since you might not all know about us. We are a professional society of doctors and clinicians treating patients with cancer. We have over 50,000 members in more than 170 countries, and our international membership is about 40%. We've made, in the last couple of years, ASCO membership free in low and lower middle income countries. This is our 5-year strategic plan. Our mission is conquering cancer through research, education, and promotion of the highest quality patient care. And our vision is a world where cancer is prevented or cured and every survivor is healthy. I think we're already united in our voice that this should be our shared mission and vision. Our 5-year goals are that over 5 years, we're going to advance global access to cancer care and research, develop more sustainable work environments, and improve the delivery of information that drives better patient outcomes. And we'll do that in 3 pillars: access to care and research, profession, and knowledge. In order to better serve our international members, we formed regional councils with members from regions to better inform us of what ASCO programs, projects, and services might be tailored to fit the given regions. We formed our Sub-Saharan Africa Regional Council in 2022. And this shows the makeup at present of our regional council. Members rotate through. Your current Kenya regional council member is Dr. Sitna Mwanzi. And if you want to be connected, you can email regionalcouncil@asco.org and we'll connect you with your regional council members. I thought I'd spend the rest of this talk talking about ASCO's global efforts to improve cancer care, 4 major focus areas where we can talk about how we might partner with NCI Kenya and the country of Kenya more broadly for partnership and collaboration. And those include quality care, education and training, clinical research, and leadership development. Let's start with quality care. ASCO helps define what quality care is through our quality programs. And we have a new ASCO certified program in patient-centered cancer care that has 7 primary domains. And we've just this week updated with a few more domains that you can see over on the left. Those 7 key primary domains that revolve around patient-centered care are patient engagement, availability and access to care, evidence-based medicine, comprehensive team-based care, quality improvement that's continuous and monitored, goals of care and palliative and end-of-life care discussions, and anti-neoplastic therapy administration safety. You can look up these standards as well as the new topics that have just been updated at asco.org/standards. We have LMIC quality projects in partnership with ASCO ongoing in Uganda and Honduras, and we have an MOU with the World Health Organization on quality care and delivery of quality care as well.
Thank you very much. That is an introduction of the partnership that we've had with American Society of Clinical Oncologists, our Prime Cabinet Secretary, and our CS. A lot of work that we are doing within the country and without to strengthen the cancer initiatives in the best interest of preventing cancer in this country and also treating well those who unfortunately get diagnosed with cancer. Allow me, our Prime Cabinet Secretary and our CS, to acknowledge the Board of Trustees of the National Cancer Institute of Kenya as I invite the Chair to take over the program from here. We have Board of Trustees and the staff from the National Cancer Institute of Kenya. We also have guests from the U.S. Embassy. We have guests from World Health Organization. In the interest of time, we may not be able to have them address us this morning. Kindly, the Chair of the Board of Trustees of the National Cancer Institute.
Yes, morning again, everyone. Welcome again to the chief guest, the Prime CS, the Cabinet Secretary for Health, and all the dignitaries. All protocols observed. At this point, I'd like to welcome the Group CEO of AMREF, Dr. Githinji Gitai, who also happens to be my predecessor in this position. He was the former chair of the National Cancer Institute, to give us a few remarks. Thank you.
Well, thank you very much, Chair NCI, my brother and friend for a long time, Dr. Olweni, Excellency, Prime Cabinet Secretary, CS Health, Adendole, PS of Health, Oluga, the Governor of Kisumu, who's been a great champion of this cause, and the First Lady as well, and Prime Cabinet Secretary. I remember when we hosted the first National Cancer Summit. That was February 2nd, 2023. The Governor of Kisumu and the First Lady were also present. That was the inaugural one. And they did make remarks from their personal experiences and also in terms of the governance and the leadership that Kisumu has been showing. Allow me to make very, very quick remarks because I know how tight this program is. First, in 2023, when I was the chair of the National Cancer Institute, we were asking ourselves, and I must thank the board that continues to support the Board of Trustees, the chair, and the CEO, Dr. Meli, for continuing this agenda. Thank you very, very much. We asked ourselves, as the National Cancer Institute, which is an agency of the national government under the Ministry of Health, what is our role? Because ideally we know that there are many convenings that happen at technical level. Researchers do meet. We know that clinicians do meet. We know that industry, that's represented here by our sponsors, and we thank you most sincerely for enabling this to continue, also have, convenings to discuss what they need to do. We know that palliative care, patient groups, all these people meet. But we said that our biggest role at the National Cancer Institute was to bring all these voices together so that we could actually inspire change and collaboration. So that's why we founded the National Cancer Institute, and we held the first one on 2nd to 4th of February 2023. That has now happened, and this is the second one, so it makes me very proud, PCS and CS, to have been invited back here, because it means that when I left in good stead. Otherwise, they would not have invited me to come back. So thank you very, very much. I'll leave just two very quick points. That if you look at the burden of cancer in this country, the CEO, Dr. Meli, has talked about the numbers. We know the numbers. I don't have to recite those. It is significant. And this is not only in Kenya, it's across the continent of Africa. The one thing we must ask ourselves is it affordable to actually provide good, equitable, accessible care to that burden? The Kenya government is doing a whole lot. And we must thank the government for the efforts that have been mentioned here by those who have had, this burden, have suffered this burden. But when you look at the fiscal space, the available money, and you look at our structure of health financing, we would need about $1 billion, Cabinet Secretary, in my view, and PCS, to actually take care of everyone who needs to be taken care of, the screening, the prevention, and the care and treatment needed at our current burden. I would estimate that at about $1 billion. That's about more than 100 billion shillings, which is close to a quarter of our health expenditure generally, which is unaffordable in a country whose GDP and population and the tax collection is as it is right now. We have to face the reality that the fiscal space is low. And also knowing that the donors, and I talked about this in the first summit, the donors do not support the non-communicable disease sector, largely because most of the donor aid that we know that's now declining is actually driven by what we call global health security. It is the disease you have, let me keep it away from my people. That's really what drives the global health security. Of course, we have partners who've stuck with us, and that's the private sector in this area, and we thank them. But we know that the development assistance in the multilateral structure is guided by global health security. So the cancer care of hypertension and diabetes is a national agenda. It's not going to be anyone else's agenda. We will not have an international cancer fund that funds our cancer care. Now, when you look at that and you look at the expenditure that's needed, I then conclude that the only way we can take care of this burden is actually to focus on the low-hanging fruits, which are in prevention, early screening, and ensuring we downstage our cancers. Prime Cabinet Secretary, 70 to 80% of our cancers come at stage 3 and 4. And therefore, the cost of care is what brings me to that 100 billion Kenya shillings. But if you are to actually reduce and downstage through several things, I'll just say a few and then I'll hand over back to the chair. One is that we need to ensure that we spend money on early screening through the Social Health Authority, early screening, and ensuring we have early diagnosis and early treatment. That will bring down our cost of care significantly. It's possible. Number two, and that should cut across all the cancers. Number two is to ensure that we decentralize care, and that's what we've been trying to do with the National Cancer Institute when I was there, and I'm sure it's still doing the same to ensure the counties are a critical part of basic cancer care. Number three is to ensure that we actually achieve 70 to 80% of HPV vaccination of young girls. If we don't do that, our burden of cervical cancer will continue to increase. I know the Kenya government has been doing a lot, but we need to target at least 80% of all girls before 14 years. And this needs community participation and school-based programs for us to achieve. The final thing, on many of the other cancers, and I know there are many experts here, so I'll not speak on their behalf, that cancers like breast cancer, colorectal and all this are also related to diets. I know that the WHO has put guidelines on control of industrial trans fats and hydrogenated oils. But Kenya has never really moved forward to implement the 2 grams per 100 grams of intake that would actually reduce the consumption of industrial trans fats to start making gains on these other cancers like breast cancer, prostate, and colorectal. There is enough brains here to assist us and Ministry of Health and the government to make sure that Kenya becomes one of the 3 states in Africa that will have implemented the WHO recommendation control of industrial trans fats. I want to end there and say that I really celebrate the presence of communities here, the communities that have been working with all of us on the advocacy for ending and reducing the burden of cancer. This is the reason the summit is here, to bring every single voice together. Thank you very much, and I thank you, and thank you, Excellencies. Thank you.
Thank you very much, Dr. Gitai, for sharing those insights both from a local and a global level. At this stage, I'd like to welcome the Principal Secretary in the State Department for Medical Services, Dr. Uma Oluga, to come and address the gathering. Thank you.
To the Prime Cabinet Secretary, His Excellency Musalia Mudavadi, Cabinet Secretary for Health, Honorable Aden Duale, colleague PSS present, the Chair of the National Cancer Institute, Governor of Kisumu, colleague doctors, partners, good morning. PCS and CS, mine is very short. It's just to recognize my colleague PSS who had come to this summit because we have employed a whole of government approach, particularly on issues of public awareness, education, and also interventions that relate to prevention and early detection. And with your indulgence, PCS and CS, you'd allow me just to call my 3 PSS colleagues just to have 1 minute each to address us, and then I will give only 3 minutes to Professor Shaukat, who is the Principal Secretary for Science, Innovation and Research, particularly because of his role in the International Atomic Energy Agency, where he is just left, and particularly in his role in the acquisition of 2 LINAC machines that has enabled us to operationalize 2 cancer centers. So I will start with my colleague PS Liban, who is the PS for Petroleum, just to make very quick remarks in a minute, and then PS Salome Biako.
Prime Cabinet Secretary, His Excellency, CS Duale, colleagues, PSS, invited guests, good morning. My name is Mohammed Liban. I'm the PS for Petroleum, in the Ministry of Energy and Petroleum. I'm honored to be here, to be invited by my colleagues, because I'm dealing with petroleum, the diesel, the petrol, and also the jetty. These are hazardous products. If not taken care of, it can cause a lot of damage. Because at the ministry level, we are working at upstream. That is where we are doing exploration and also production of oil and gas. Care has to be put in place to ensure that there is safety when we are using that. At the same time also, we are doing security of supply, because petroleum is an enabler to the economy. We need it, for manufacturing, we need it for transport, we need it for roads, we need it for energy. But safety and security has to be put in place to make sure that our country is safe. So having said this, because once we are doing, our daily programs, especially in exploration, we ensure that oil and gas is found, underneath. And it's a mixture of also elements, like lead, like also mercury, which is hazardous, to the health. So the State Department, we are monitoring, we have a State Department to ensure that whatever we are doing, we make sure that environment is safe to all Kenyans as moving forward. Having said this, cancer, when I'm talking about cancer, especially in Ministry of Health, we have 3 levels of treatment: the primary, secondary, and tertiary. Primary prevention is where the disease has not occurred. And that is very critical, because the screening of cancer and other diseases will be very, very crucial. And I thank, the Ministry of Health, by bringing up, the community health promoters is very key, because that is the areas where we can actually detect and ensure that this disease will not progress to other. So, second level of prevention is where disease has occurred. That is, we are supposed to look at our infrastructure from level 2, 3 up to tertiary level, the affordability, the accessibility to Kenyan people. I think that is a big task for Ministry of Health. And then the third level of prevention is palliative care. All is not lost. Once the disease occurs, then we are supposed, to take care of our people who are actually taken care of. To conclude it, when we attained, our independence, the government was fighting with 3 conditions: poverty, ignorance, and disease. At that time, we were dealing, with preventable diseases, which is gone. Now we are caught up, with non-communicable diseases: diabetes, hypertension, and cancer. I think this summit will enlighten, the Kenyans as well, to make sure that our people get good health. Thank you so much.
Thank you so much, PS Liban. PS Salome.
Your Excellency, the Prime Cabinet Secretary, Dr. Musalia Mudavadi, Dr. Musalia, the Cabinet Secretary Health, Mr. Adan Duale, the Governor of Kisumu, Your Excellency, together with Her Excellency, my colleague PSs, PS Shaukat and PS Liban, all invited guests, good morning. My name is Dr. Salome Biako. I am the PS Correctional Services, and I'm very gratified for this invitation by Dr. Uma Oluga, the PS Medical Services, primarily because I'm charged with the care of over 60,000 inmates in Kenya across 135 prisons. And one of the biggest problems we are grappling with is cancer, particularly prostate cancer and to a very small extent breast cancer. Why do I say to a small extent? The reason is because 95% of all our inmates are men. And the bills that we have accrued in that space are astronomical. And I'm very happy that you have this summit. And I would urge all the delegates and participants in this meeting that when you're deliberating on the issues of solving, particularly prevention, diagnosis, and palliative care of cancer patients, kindly consider to come into the space of correctional services. We have been working with PS Oumba Oluga Medical Services in registering all our inmates under SHA. And I would hope that one of the resolutions you can make is to have regular screening of all our inmates, because that population is really aggravated by cancer. Thank you very much, and I wish you all the best in your deliberations in this summit. Thank you.
Thank you so much, Professor Shaukat. I see you have a speech, but you only have 3 minutes maximum.
Thank you very much, PS Oluga. Prime Cabinet Secretary and Cabinet Secretary Foreign and Diaspora Affairs, our Cabinet Secretary Health, Honorable Aden Duale, my colleague PS Medical Services, His Excellency the Governor of Kisumu, and Her Excellency the First Lady, my colleagues, Principal Secretary present, distinguished guests, ladies and gentlemen. Let me also take this opportunity to thank my colleague for inviting me to come and make some brief remarks. I'll make it short, Oluga. Just our chief guest, this summit is more than just an event. This is a very powerful platform that brings diverse voices and also to have a unite mission so that we can be able to address. My brother, when he spoke about numbers here, we are looking at 42,000 new cases and almost 28,000 deaths. These are not just numbers. There are families and people behind these numbers. And Your Excellency, if you look at the bigger picture, according to the Globocan 2020, there are about 1.1 million cases in Africa and almost 400,000 cases. That means there is a need for us to have this call so that we can address this surge. I'm really honored to stand here and take the pride, Your Excellency, being one of those founder members of the National Cancer Institute under His Excellency when he was the Minister of Medical Services at the time. And my journey took me to the International Atomic Energy Agency, of which we were able to train many Kenyans and also be able to facilitate the procurement of the LINAC in the Moi Teaching Referral Hospital, and Cabinet Secretary, as you're aware, also the 2 LINACs, one in Mombasa and another one in Nakuru. This is under the rays of hope. Excellency, I need to continue mentioning this. You are in Vienna yourself. You had a dialogue with the DG of the IAEA. We have great opportunity that we need to continue to partner with the IAEA. We are looking at the uniting our voices and taking actions. I would like quickly to focus on a specific area on the diagnosis and treatment of cancer. And my focus will be mainly on the radiotherapy, because documents and studies have indicated at one point or another over 50% of the cancer cases will require radiotherapy. So as much as we continue with the palliative care, preventive care, and also looking at the chemotherapy, there will need for us to have this radiotherapy as well. So for me really is to continue with the research for evidence-based, and I'm glad that we are working very closely with the Cancer Institute and of course KEMRI and the ministry to generate more data, innovative for affordable, accessible solution. I'm pleased to inform you, Your Excellency, that we are working closely to have digital screening tools, and as you've seen outside, the use of the AI so that we can be able to interpret the data from the radiology and the rest. But the elephant in the room is on capacity building. We have to continue training our people, and I'm pleased to let you know, Your Excellency, that my work at the IEA still continues while I'm here to help the country. We are looking at Kenyatta University Teaching Referral Hospital Cabinet Secretary, and I have made recommendations that it becomes the centers of excellence so that we can be able to train Kenyans and Africans. And also looking at the strategic collaboration, public-private partnership is very critical. One thing that, Excellency, I would like to mention here, according to standards, we're supposed to have 1 machine per million population. Kenya at the moment is standing at about 19 machines. So we have a deficit of about 36 machines. If you do a rough estimate, that will cost us about 90 billion Kenya shillings just to procure the linear accelerator. I know Cabinet Secretary is on that. As I come to conclude, I want to continue urging the increased investment in research. And under National Research Fund, which is domiciled in my State Department, I will continue advocating for that. Secondly, we also have a draft plan with the National Cancer Institute to finalize the roadmap of the National Cancer Agenda. And second to last is to look at the data. It is very important that we generate our own data so that we can have all this precision treatment. My closing call of action is just to let everybody know that science is our compass, research is our engine, innovation is our bridge to equity and to hope. Let's unite our voices. Let us take action. Let us build Kenya where cancer is no longer a death sentence, but a battle where we're ready to fight and win together. Once again, I thank you and I wish you all a very fruitful deliberations.
Thank you so much, Your Excellency and CS. I had to be kind to Professor Shaukat because Waziri has directed me that we find a mechanism to ensure all our regional cancer centers, we manage them, the equipment, and I am talking to him nicely so that we can get some support from the International Atomic Energy Agency. So you will indulge me. Your Excellency, we from the State Department of Medical Services are very keen on 2 areas. As we discuss the general country policy around cancer, we are keen on making sure that hospitals perform the functions well in terms of clinical workflows so that cancer patients are not tossed from one side to another. There's a very clear pathway how they get into the facility, how they get their care, and how they get out. And secondly, sir, is we are also ensuring that we match the resources with the policy so that we get efficiency in terms of resource deployment. With those very many remarks, I would like to invite His Excellency, the Governor for Kisumu, Professor Peter Anyang' Nyong'o, to address us.
Your Excellency, the Prime Cabinet Secretary, my dear friend Musalia Mudavadi, the Minister for Health, my dear friend Duale, distinguished gentlemen and ladies here today, I really come here now to say very little, because a lot that I had to say have been said by my predecessors who were on this podium, Professor Shaukat in particular. But really, it is my great honor to join you today at this second National Cancer Summit, a gathering that speaks not only to our collective concern, but more importantly, to our shared commitment to changing the course of cancer care in Kenya. Cancer, as many of you may know, is now the 3rd leading cause of death in our country, following infectious and cardiovascular diseases. We are facing a rising tide. Over 58,000 new cases annually, projected to increase to 95,000 by the year 2040. The time for dialogue is now, but more crucially, the time for action is now. Today I want to speak to one central issue: how we move from policy to practice, from paper to patient, from intent to impact. And I speak both as a governor and as someone who has walked this journey from national policy halls to county hospitals, from boardroom consultations to community health units. During my time as Minister for Medical Services, I initiated the process that eventually led to the establishment of the National Cancer Institute of Kenya, of which a lot has been said today. Today, I stand proud of what it has become, a national institution anchoring our cancer response. Equally, I celebrate the opening of public cancer treatment centers beyond Kenyatta National Hospital, beginning with Kenyatta University Teaching, Referral and Research Hospital, and now extending to 5 additional regional centers. What is happening at Kenyatta University Teaching and Research Hospital is really magnanimous. Last year, the Minister of Health launched the National Cancer Control Strategy 2023 to 2024, a well-thought-out framework anchored on 5 pillars: prevention and early detection, diagnostics, treatment and palliative care, strategic information, and financing. I applaud this strategy. But we must now confront the harder question: are we implementing this strategy? Are we matching vision with capacity, ambition and accountability? And is our Treasury prepared to finance this strategy to the end? Back home in Kisumu, we have internalized this strategy and contextualized it to fit our local reality. Cancer, particularly cervical and breast cancer, is an urgent public health threat in our region. And my First Lady and other First Ladies in the LREB region have been seized with the responsibility of early detection by examining young women for cervical cancer and breast cancer. Our statistics tell a stark story. Less than 15% of eligible women are screened. Let me repeat that. Less than 15% of eligible women are screened, and many are diagnosed too late. We therefore resolve to act and act boldly. Through partnerships with organizations such as KMET, Cure Cervical Cancer, Africa Cancer Foundation, and PEPFAR, we are implementing a community-based screening program targeting every eligible woman in Kisumu within 3 years. We are also addressing prevention. Under the leadership of our county First Ladies as champions, we have increased HPV vaccination among girls aged 10 to 14 from 12% in 2022 to 38% in 2024. This has been achieved through community health workers, schools, nurses, and grassroots advocacy, supported by partners like the American Cancer Society and UNICEF. Our efforts are bearing fruit, with LREB counties posting the highest see and treat rates, a testament to what committed advocacy and partnership can deliver. The Constitution of Kenya 2010, ladies and gentlemen, gave counties the mandate to deliver health services, and that devolution has been a game changer. In Kisumu, for example, it allowed us to digitize community health, recruit gynecologists, oncologists, and now move toward the completion of a comprehensive cancer center, which will soon provide surgical and radiotherapy services under one roof. And as we move Jaramogi Oginga Odinga to the national level, I have pleaded with my friends over there to leave Victoria Hospital to us. because it's our center for cancer research, teaching, and cure, and our center for dealing with sickle cell anemia. And I'm sure that our minister who is here may enlighten you further what that goal is. But let us be honest. The power of devolution is not automatic. It must be supported by adequate financing, a clear division of roles, and coordinate implementation between national county levels. As such, the Ministry of Health has been very good in recognizing this partnership, and I thank my colleague. Despite good policy frameworks, we still face implementation bottlenecks. One, many counties lack essential diagnostic infrastructure. Two, we face an acute shortage of oncology specialists. Three, financial protection remains elusive for many patients and proposals. And lastly, we cannot ignore social and cultural barriers. Fear, stigma, and misinformation continue to hinder early diagnosis and care seeking. Indeed, as I've been told by my friends at Jaramogi Oginga Odinga teaching at Ifo Hospital, people don't want to be told that they have cancer. If you say so, they think you're pronounced a deathbed. But that is not the case. I think more public education will make sure that cancer is treated like any other disease, preventable, curable, and indeed something that should be such a threat to humanity. We must address these issues head-on. Let us not be content with writing strategies. Let us instead commit to funding them, staffing them, equipping them, and measuring their impact. As I close, ladies and gentlemen, let me say that to ensure that policy translates into impact, counties must operationalize the national strategies pillars, from prevention and screening to diagnostics, treatment and palliative care at every level of the health system. Two, stakeholder coordination must be institutionalized. National government, ministries, county departments, healthcare workers, NGOs, community health volunteers, and development partners must align on plans, funding, and messages. Three, community engagement and demand creation, as we have done in Kisumu, must be at the center, because the greatest interventions fail if people do not trust or understand them. Four, we must invest in surveillance, training, research infrastructure, including national reference laboratory and robust data systems. Five, and lastly, and critically, we must scale up financing mechanisms, including public-private partnerships, domestic resource mobilization, and risk pooling through insurance to cushion Kenyans from catastrophic health expenditure. Let this summit spark a renewed commitment, not just to talk cancer, but to treat it, to prevent it, to fund it, and to eradicate it where we can. As the governor of Kisumu, I pledge my full support to the national cancer agenda. Let us work together across counties, ministries, civil society, and development partners to ensure that every Kenyan, wherever they live, get the care they deserve. Together, let us ensure that no one is left behind in the fight against cancer. I thank you.
Thank you so much, Prof. We take your words with a lot of value because of the journey that you have walked in supporting cancer. Waziri and PCS, I'd just like to recognize the chair of the Kenya National Chamber of Commerce because of the partnerships with the private sector. And then I take my seat. Dr. Ruto, he is waving. As I take my seat, I now invite back the chair of the National Cancer Institute, who is hosting us, to invite you, and you can then invite our chief guest. Thank you. And we wish you blessed deliberations. Thank you.
Thank you very much, PS. I think it was extremely important that we have representatives from the other ministries within government. And the reason is, first of all, they have got a role to play in terms of the risk factors for cancer, the modifiable ones. We need to manage them. Secondly, it also impacts the social determinants of health, which is extremely important. And thirdly, you must appreciate that there's a direct relationship between poverty and ill health. Poverty is both a cause and a consequence of ill health. And if there's one intervention that will improve our health status significantly, it is alleviation of poverty. And that is why economic transformation is of necessity at the center of this administration's agenda, and it must be, if we're going to make an impact in terms of our cancer patients. The second thing I'd like to comment is that we cannot achieve universal health coverage, and especially for our patients, for cancer patients, without bringing down the cost of healthcare in our country. That's a discussion I've had with every cabinet secretary I've interacted with, including our current one, and I've got a strong belief he's the one who will bring us together and have a debate in which we can be able to bring down the cost of healthcare. With those few remarks, I'd like to at this point now welcome our Cabinet Secretary for Health, Honorable Aden Duale, to come and address us. Thank you.
Your Excellency, the Prime Cabinet Secretary and CS for Foreign Affairs, the Governor of Kisumu, His Excellency Professor Anyang' Nyong'o, and the First Lady, PSS President, the Chair and board members of the National Cancer Institute, including the CEO, the following partners, civil society representatives, healthcare professionals, cancer survivors and advocates, members of the Fourth Estate, fellow Kenyans, good afternoon. It is my honor to address you at this very important second National Cancer Summit, a critical gathering where we reaffirm our commitment to saving lives, reducing suffering, and building a future where no Kenyan dies from cancer. Cancer is not just a health crisis. It is a national emergency. Every day, more than 120 Kenyans are diagnosed. Every hour, families lose their loved ones. Each year, close to 29,000 lives are lost. These are not just numbers. They are people with names, families, and dreams. But today we come together, government, civil society, researchers, our county governments, partners and private sector, and the public, not simply to talk, but to act. And the theme, Uniting Voices, Taking Action, is a call for urgency and solidarity. Our National Cancer Control Strategy 2023-2027 provides us with a very clear roadmap covering prevention, diagnosis, treatment, palliative care, financing, and research. We are decentralizing cancer care as a country. Our regional cancer centers are now operational in Nairobi, Eldoret, Kiambu, Mombasa, Garissa, Nakuru, which is a major step towards equity in access. Through the National Equipment Service Project, we are strengthening our cancer care by equipping our national and county referral hospitals with essential screening and treatment equipment. Mammograms have already been installed in Kisumu and Kerugoya, while CT scans are operational in 15 county referral hospitals, with installation underway in another 15 additional counties. Data is our compass. Our national cancer surveillance platform is enabling real-time data to drive smarter, targeted decision-making. On prevention, the ministry has successfully integrated the HPV vaccine into our routine immunization schedule, targeting adolescent girls aged between 9 and 14 years. This is a momentum step towards the elimination of cervical cancer. We are expanding our community-based screening for breast, cervical, prostate, among other cancers, through community health promoters and mobile outreach teams. Early detection saves lives. We are also strengthening our referral system to ensure timely follow-up and care. No Kenyan should suffer or die because of delayed treatment. Through the Taifa Care, we are building a health system which is more inclusive, equitable, and responsive. The Social Health Authority is very central to this transformation, with over 24.9 million Kenyans enrolled as of last night. Every day, between 40 to 50,000 Kenyans enroll on our platform. The Social Health Authority provides up to 550,000 per year through the Social Health Insurance Fund, an emergency, chronic, and critical illness fund for cancer diagnosis and treatment. Additional services covered include surgical procedures, inpatient care, outpatient care, and palliative care in line with the SHA benefits and tariffs. No Kenyan should be forced to choose between treatment and feeding their family. The government, under the leadership of President William Ruto, has made it very clear that the health of our citizens comes first. To date, SHA has received oncology claims amounting to 5.8 billion in the last 9 months, benefiting 49,315 patients who have accessed various oncology services, including the following: 15,300 patients received chemotherapy, 2,200 underwent radiotherapy, 2,609 accessed the PET scan, and 1,390 went through, under the SHA program, CT scan. And thousands more have benefited from other cancer diagnostics and intervention. We urge all Kenyans to register and contribute to the Social Health Insurance Fund. This is your protection. This is your family future. To further strengthen access to oncology care, the Ministry of Health, and I want to say it with a lot of pride, that we have signed an MOU with Roche, and I'm sure they're here, one of the biggest pharmaceutical company, to provide Herceptin 600 milligram SC and other products, therapies to eligible SHA beneficiaries. Please, let's clap for Roche, a biological therapy that is used to treat breast cancer and gastric cancer, which make up 15 to 20% of all the cancer cases. It's a critical addition in the fight against cancer. This partnership we have with Roche has reduced the cost of treatment from 120,000 Kenya shillings to 40,000 per session, fully covered by SHA with no co-payment for our patients. These therapies will be available across all SHA-contracted healthcare facilities nationwide. They can be found both in the public, private, and faith-based. And this is to ensure equitable nationwide access. The ministry, under my leadership, encourages other pharmaceutical partners present here and those who are listening to us to join in expanding access to affordable, patient-oriented, and high-quality cancer care. However, ensuring access to therapies must go hand in hand with early detection. Over 70% of cancer cases are diagnosed late, mainly due to limited access, stigma, and misinformation. We must expand diagnostic and radiotherapy services in the most undeserved areas and promote early health seeking by normalizing cancer conversation. Geography must not determine survival. To our county governments, please prioritize cancer in your budgets. Ring-fence funding for screening, public education, and referral infrastructure. Decentralized action is very essential. To our healthcare professionals and researchers, lead with evidence, compassion, and innovation. Train the next generation, generate local data, improve the outcomes. To our partners and the private sector seated here, work with us, invest in localized, affordable cancer care solutions that are scalable and sustainable. To the media, civil society, survivors, and our citizens, use your voice, raise awareness, break stigma, support one another. Early detection saves life. Let this summit be remembered as a moment we shifted from plans to impact, from words to action. Let us unite our voices and deliver a future where cancer is no longer a death sentence, but a challenge. We meet with courage, equity, and national resolve. With those remarks, it is now my honor and duty to welcome my boss and old friend, the Prime Cabinet Secretary, and the CS for Foreign Affairs and Diaspora Affairs to deliver his keynote address. Thank you, and God bless you all. God bless Kenya.
Thank you. You may be seated. The Honorable Adan Duale, Cabinet Secretary for the Ministry of Health, my good friend Professor Anyang' Nyong'o, Madam Dorothy, Principal Secretaries present, the Director for Health, the Chief Executive Officer and board members of the National Cancer Institute of Kenya, county health officials, development partners, healthcare professionals, cancer advocates and survivors, distinguished guests, ladies and gentlemen. It is a great honor to stand before you today at the opening of the second National Cancer Summit, a timely and vital gathering of minds, leaders and changemakers dedicated to defeating one of the most formidable health threats of our time, cancer. Mr. Minister, on a lighter note, I did not take the Bombay ambulance to get here. Allow me to begin by congratulating the Ministry of Health, the National Cancer Institute of Kenya, and all partner institutions for convening this important summit under the inspiring theme, Uniting Our Voices, Taking Action. It is not only a call to solidarity, but a declaration that the time for fragmented efforts is over. The time to act collectively and decisively is now. Cancer is a growing national and global challenge. It continues to exert a profound toll on the lives of Kenyans and health systems. The burden of cancer is not just medical, it is economic, social, emotional, and psychological. For this reason, we must approach cancer not as a health issue alone, but as a national development priority that requires a multi-sectoral and multi-stakeholder approach. If we are to meaningfully address cancer, then all sectors, not just the health sector, must come on board. We must embrace a multi-sectoral national response to cancer. We must break down silos. The Ministry of Education must ensure that cancer awareness is integrated into our school curricula and life skills programs. The Ministry of Agriculture and Livestock Development, as well as the Ministry of Investments, Trade and Industry, must regulate this one is a big one. Carcinogenic products which promote health and nutrition and ensure food safety. The Ministry of Environment and Forestry must address environmental risk factors such as pollution and hazardous exposure. The Ministry of Information and Communications and the Digital Economy must support cancer registries, telemedicine, and digital patient care platforms. The National Treasury and Planning must prioritize and sustainably fund cancer prevention and treatment programs. The Ministry of Roads and Transport must ensure improved networks to make it easier for Kenyans to reach screening, diagnostic, and cancer treatment centers, and the list goes on. And crucially, county governments under devolved healthcare must localize, fund, and lead community-level interventions. In short, we must embrace a whole-of-government and a whole-of-society approach. We must bring all hands on deck, including the healthcare workforce, pharmaceutical companies, civil society, the private sector, academic institutions, faith leaders, media houses, communities, and above all, cancer survivors and caregivers. Ladies and gentlemen, as we respond to the internal challenges of cancer, Kenya is also looking outward with a bold vision of becoming a regional hub for cancer treatment, training, and innovation in Africa. This will position Kenya as a regional hub for cancer care. We already have critical building blocks in place, and I will repeat them because they have been alluded to. The operationalization of the regional cancer centers in Nakuru, Mombasa, Meru, Kisumu, and Garissa. The scaling up of radiotherapy, chemotherapy, nuclear medicine, and surgical oncology services. The emergence of highly skilled oncologists, radiologists, and oncology nurses trained locally and internationally. The advancement of cancer research registries and precision imaging technologies through public and private investments. We are not merely responding to disease. we are building the infrastructure systems and workforce that can anchor medical tourism, regional referrals, and clinical trials within Kenya. Our ambition is clear: to serve not just Kenyans, but also our Eastern and Central African neighbors who seek accessible, affordable, and high-quality cancer care. This ambition cannot be achieved in isolation. The government of Kenya, through my office, has prioritized health diplomacy as a cornerstone of our external relations. Through bilateral and multilateral partnerships, we are engaging meaningfully with international organizations and cancer control bodies, including the World Health Organization, the International Atomic Energy Agency, and Professor here spoke to it, the Union for International Cancer Control, and numerous UN agencies, regional blocs, and philanthropic institutions. These collaborations have resulted in strengthened diagnostic capabilities, technical support, equipment donations, knowledge exchange through capacity building, and access to global best practices. I take this opportunity to express our deep gratitude to our development partners and technical agencies who have worked with Kenya in this journey. The national government remains firmly committed to expanding these international collaborations in line with our national cancer control strategy and the aspirations of Kenya Vision 2030 and Agenda 2063. As a government, we recognize that cancer is a borderless crisis that requires borderless cooperation. That is why we have reaffirmed our role in international cancer diplomacy by participating in global cancer summits and World Health Assemblies, strengthening our voice in regional economic blocs to prioritize cancer under trade, health, and human capital development, hosting South-to-South collaborations for oncology, training, and knowledge exchange, and aligning our policies with UN and WHO global cancer targets, including the target to reduce premature mortality from non-communicable diseases by 1/3 by 2030. We are determined to position Kenya as a credible, responsible, and proactive partner in global cancer control. We shall collaborate with international organizations and other industry players in cancer care, in research, innovations, and in developing new health products and technologies. We are ready to learn, ready to lead, and ready to leverage on our networks to serve our people and the region better. As we expand infrastructure and partnerships, we must not lose sight of the people at the heart of this response. Cancer care must be patient-centered, culturally sensitive, and grounded in evidence. Evidence generated from research. Evidence-based, targeted interventions lead to optimal utilization of resources. As Honorable Dwale said, behind every statistic lies a story, a family shattered, a dream delayed, a life stolen too soon. Yet within these stories, we find resilience, hope, and the unbreakable spirit of survivors and caregivers. Today we stand united, not just in sorrow, but in our resolve to turn the tide against cancer. We are not powerless. We are powerful when we join hands, when we unite our voices, and when we act with purpose. Every Kenyan has a role in this battle. Whether you shape policies, heal patients, educate minds, grow food, or inspire the next generation, your actions matter. Your voice matters. Let us leave this summit not with words alone, but with a commitment to bold, measurable steps towards a cancer-free Kenya. Let us honor those who have lost by ensuring their pain is not the legacy of our future. May we draw strength from our unity, courage from our convictions, and hope from our shared humanity. Together, we can and we will defeat cancer. It is now my honor to officially declare the second National Cancer Summit 2025 open. And just one extra minute, Mr. Minister Duale, let me just commend you and your team because you've brought a lot of new vigor to the health sector. Vigor and purpose. And we really want to encourage you to continue on that trajectory. I don't know if there's a lady Musembi within the hall. Dr. Musembi, is she around? Maybe, maybe not. But I think she's one of your senior oncologists somewhere. Where is she? I don't know. Okay.
Professor Musimbi,
is it?
If she's in the audience, but in the event that she's not here, our PCS,
yeah.
I will make sure she comes to your office and the CSS office.
No, there's nothing wrong. I just actually wanted to acknowledge her because my first serious encounter with the aspect of cancer was through her initiatives. She was really involved, working with the Pink Ribbon movement to bring a lot of awareness to matters around breast cancer. And Professor Nyong'o, I don't know that you were there then, but we even had a camp in Ole Tepis, in Kajiado, and she was the lead facilitator. And we actually pitched camp and spent the night with her and several other professionals in Kajiado. And I was really inspired by what she was doing and what they were doing. And those of you who are here as well. So I just want to recognize that I do remember a very powerful lady. And she remains very powerful. And to all of you who are doing an excellent job. Thank you. God bless you all. Asante sana.
Thank you very much, His Excellency, the Prime Cabinet Secretary, for your great words and, of course, for sharing with us. Please be seated. What the government is doing through policy and programs to help deal with cancer in the Republic of Kenya. Thank you very much. And now the meeting is officially opened. Without further ado, I want to invite the CEO of National Cancer Institute of Kenya to take us through the Empower program, and thereafter we are going into the award program. Thank you.
Thank you very much. Our Prime Cabinet Secretary, our CS distinguished guests, thank you for the commitment to invest in this cancer prevention and control. We're now moving to kindly PCS and CS indulge us with just a few more minutes to go through three very key items that are before us. One of them, appreciating the role of data, and data being the new oil. We have worked for a long time with our partners, Roche again, CS, and the first county ladies on a program called Empower that has been doing screening activities in the communities. And we are privileged that that team is going to hand over this great work to the National Cancer Institute of Kenya, to the Ministry of Health, to continue. To carry us through this session, allow me to invite the General Manager, Roche, East Africa, Miss Jackie, and also our very able First Lady, Kisumu County, Her Excellency, Madam Dorothy Nyong'o. Kindly join me up front as we showcase this great work that we've been able to do over the last couple of years. We are embracing partnerships and collaborations from all the stakeholders. Her Excellency, Madam Dorothy Nyong'o, will speak first about this program, and we will proceed from there.
Good afternoon. All protocols observed. I've been ambushed. Anyway, I'm really happy to share the experience with Empower. This is a program that was started in 2019, a partnership between the County First Ladies Association, Roche, International Cancer Institute, Africa Cancer Foundation, Women for Cancer, and we decided that we needed to get screening services to be available to the grassroots woman on a regular basis. So after a lot of consultation, we went around the counties and partnered with the county governments to set up what we called Empower Clinics. And by the time COVID hit, we established 19 Empower Clinics in spite of COVID. And the purpose of the clinics was to ensure that Monday to Friday there was a facility available at the county hospitals, level 4 or 5, where women could go in to get a screening. And this has been really remarkable. It was a game changer. And it allowed women to walk in freely and get screening and then to be navigated through the system to get early diagnosis as well as early treatment. I think I will leave it there and get Jackie to share the rest of the story.
Your Excellencies, all protocol observed. Good afternoon, everybody. So just to conclude from where Dorothy has left, from the 20 clinics in 19 counties, we have screened over 200,000 women. We have over 3,000 patients receiving treatment in the centers. And in August 2024, we had a tripartite memorandum of understanding between Roche, Savannah, and the National Cancer Institute. And why we launched the second part was because of the learnings of the brick and mortar 20 clinics we had. And so we chose to go through the digital way to increase efficiency, which supports the UHC agenda in Kenya in terms of we want to talk about equity, efficiency, and patient centricity. So today we have 56 digital sites. We have tripled the numbers in 11 months and screened over 300,000 women. So we would like now to integrate and hand over the platform to the National Cancer Institute so that with the Ministry of Health can work together to make it a national program and platform to enhance the efficiency.
Thank you very much. Quickly now we are moving to PCS and CS to award men and women who have sacrificed a lot in this cancer space. They've made a difference, picking from where our Prime Cabinet Secretary acknowledging Professor Musibi. So I would want to ask our MC team to carry us through the award sessions so that our PCS, our CS can honor these great men and women. More often we find our scientists, researchers acknowledged abroad, while back at home we may not know that they are doing a lot of heavy lifting.
Thank you very much indeed for that presentation. And of course, standing on the established protocols, we now move to a very important, yes, please, let's put our hands together for that presentation on empowerment. And we're now moving to a very critical stage of this summit, and this is the award ceremony, and my colleague here, Mashirima Kapombe, will guide us. Thank you.
Asante sana. So we'll start with calling onto the stage our Prime Cabinet Secretary and CS for Foreign Affairs. Please come to the stage so that you can help us award our awardees this afternoon. Tumpigie makofi akija hapa mbele. You will award the CS as well, so please come first.
The CS is also an awardee, so
yes.
It's your moment.
Asante sana. So we'd like to first call O'Brien.
We're going to call Professor Frederick Chite Asirwa. He's a founding director, International Cancer Institute. He is a medical oncologist and hematologist of several access to personalized cancer care and research initiatives, including blueprint programs. And he's also a founding member of the Shining Power Tower program, where he's a prof.
And as he walks to the stage, he has developed several training programs, including the SSA Oncology Preceptorship Training, Digital Pathology Program, Telemedicine Program, Oncology Training for Physician Assistants, Development of Oncology Nursing Training Program in Kenya, Medical Oncology Fellowship Program. We could go on and on.
Another awardee is the Award of Excellence in Cancer Care. We have Professor Nicholas Anthony Otieno Abenya. Please, let's put our hands together for the good old prof.
As he walks up to the stage, this is why he's being awarded today. He holds a master's degree in internal medicine from the University of Nairobi, and this award recognizes his profound direct impact on elevating clinical practice, shaping cancer care in the country, and building the specialist workforce essential for NCIK's mandate. Tumpigie makofi. I would like to call on stage Dr. Elias Meli to receive the award on behalf of Professor Frederick Chite Asirwa. Tumpigie makofi.
Let's clap, please. Let's continue clapping. Don't get tired. We're almost coming to the tail end of this process. Our next recipient is Benda Kithaka, founder and chief executive officer, Kilele Health Association, secretariat lead, African Cervical Health Alliance. Please, let's put our hands together for another round of appreciation.
And Benda is being recognized for her integrity, warmth, and leadership in amplifying voices of the underserved and co-creating impactful tools for cancer control and management across Africa. Tumpigie makofi.
Thank you very much. Another award in the Trailblazing Woman in Cancer Care in Kenya and Africa. The recipient is Dr. Miriam Mutebi. Let's put our hands together, ladies and gentlemen, for Dr. Miriam Mutebi, and Mashirima is going to take us through her profile.
Now, Dr. Mutebi's work focuses on strengthening health systems, improving access to care, and advancing equity in oncology. She's a committed advocate, educator, and policy advisor. She works to build sustainable cancer programs and empower healthcare professionals across Africa. Makofi.
And the next award goes to a nurse.
Her name is, first of all, before I go to the name, the award goes to, because of excellence in cancer care in hardship communities. What a nurse. And this is Madam Suleka Aidan. Let's put our hands together for Madam Suleka Aidan as we go through her profile, taken by Mashirima Kapombe.
I think she deserves a better clap than that because she comes all the way from Turkana County and she's an oncology nurse working in the county, and we're recognizing her for all the work that she did in the year 2024. Makofi kabisa.
And now, after the awards, we want also to recognize people who are driving the fight against cancer and management in this country, from policy to programs. I want to invite on stage the CS for Health, Cabinet Secretary for Health, Honorable Aidan Duale. Let's put our hands together. It is not a crime for you to ululate. You can just go ahead. Thank you very much, Waziri.
And as we award our CS for Health, I think we've spent so much time in this space where there's so many doctors that you want to call everyone a doctor. CS Aden Duale, asante sana. And as he stands there, I would like to call on stage the PSs first, so that they can be awarded, and then we can award our CS Aden Duale. So our PSs, starting with Dr. Ouma Oluga, followed by Salome Biko and Muhammad Liban, as well as Dr. Shokat.
Very good. Please come to the stage for your recognition.
Tuwapigie makofi. The leadership that they've shown throughout, tuwapigie makofi.
So where are the gifts for the PSs, principal secretaries, for the work, for the good work they are doing? Remember, they are very critical in policy implementation as well as formulation. And so they are on the front line. Please, just clap.
We would now like to appreciate and call onto the stage the Governor for Kisumu County, Professor Peter Anyang' Nyong'o. Please let's give him a round of applause as he comes to the stage.
And he will be accompanied by his wife, the First Lady, Dorothy Nyong'o. Please put our heads together for the Governor and then the camera people will guide us on how the photo will be taken. And this will be followed by the launch, the much-awaited launch of something very special, something that is going to revolutionize cancer management and fight against cancer in this country. So you don't want to miss out on that. And thereafter, we are going to have a photo opportunity before we can proceed for lunch. And then we'll give you an update on the afternoon program.
And finally, we would like to call onto the stage the chair of NCI Kenya, Dr. Olweni. Please come to the stage. Tupige makofi tafadhali. Dr. Olweni will be awarded by the PCS. And then the PCS will award the CS. Pole sana CS, tumekuweka sana. And finally, after keeping him waiting for so long, the CS Aden Duale will be awarded by PCS Mudavadi.
Yeah, and now before we move to the final award, let us also recognize the award of the Excellence in Leadership and Governance in Cancer Award. And this goes to the CEO of National Cancer Institute of Kenya. We were reserving these for him, and we are reserving the best to the doctor. This is Dr. Elias Meli. He's being rewarded for what, Mashrima?
His leadership, for sure, under the National Cancer Institute of Kenya. Asante sana for your leadership and making this possible together with the other officials in the ministry. Tumpigie makofi.
Makofi jameni. And this award also is because of the great work that is being done by NCI Kenya, from the Board of Management to the Board of Directors and, of course, the staff at NCI Kenya.
And finally, PCS Mudavadi, please come to the front just a little bit. And the chair of the National Cancer Institute of Kenya will award him. There's a gift of appreciation for him.
And here comes the gift for the Prime Cabinet Secretary. Please let us put our hands together for His Excellence, the Cabinet Secretary, for the Prime Cabinet Secretary, Musalia Mudavadi. So time now for the photo op. Are we good? They're saying that you need to smile. You can put on, some beautiful smile. I can confirm that you look very good when you put on your smile. And thereafter, we are going to the launch of a very important milestone in this country, which will be guided by the Prime Cabinet Secretary.
So once the photo is taken, and as the photo is being taken, we'd like to call onto the stage Dr. Joanne Paula Bor.
Dr. Joanne, please come to the stage. Let's put our hands together for Joanne. Dr. thank you very much. She's going to guide us through the next stage as the awardees. Okay, one more. All right. Thank you very much. Please take your stage. Save for the Prime Cabinet Secretary, who is going to guide us on this. There is a special request by the Prime CS that the cancer champions to come to the stage for a photo opportunity as well, as we are taken through the program by Dr. Joyce.
Yes. And very nice photo.
Oh, they tell me I forgot something. Ooh, sorry, Basala.
All the cancer champions in the room, please just come over here for that important photo opportunity. Yeah, please just come here for your encouraging battle against cancer. Yes. And as we continue with this photo, yeah, wengine. If some people can just squat so that we capture everyone. All right, thank you very much. Time now. Thank you very much. May you take your position as we listen now to Dr. Joyce Paul as she takes us through the radiotherapy protocols. Thank you.
Thank you very much. And I wish to stand on the protocols observed.
So we can now sit.
We are now proceeding to the launch of the National Cancer Radiotherapy Protocols.
and I am just here to give a brief background before we proceed to the booth. So the radiotherapy protocols, as we proceed, our chief guest, the radiotherapy protocols is a technical document that has been developed through a multi-stakeholder engagement with the aim of providing harmonized, evidence-based framework for radiotherapy planning, delivery, and follow-up. As has been mentioned earlier, about 50% to 60% of cancer patients require radiotherapy. And as we have progressed over the years, from 2019, we had one national cancer center offering radiotherapy. Now we have 6 in the public sector and about 90 other centers in the country providing cancer care. So the aim of this protocol is to standardize care and also to guide the Social Health Authority, who will reference the protocol as the national standard for radiotherapy, ensuring accountability and consistency across all the treatment centers. This is the first document of its kind in the country, and I want to request that, with your kind permission, our Prime Cabinet Secretary and our CS, that I would invite representatives from the cancer centers offering radiotherapy so that they can join us as we proceed to the booth. I want to invite Dr. Zainab from KU, TRRH, Dr. Beatrice from MTRH, Gladys Mukosi from KNH, from the regional cancer centers, Dr. Omar from Garissa and Dr. Sivilis from Nakuru, representing
copies of the protocols. As our media team takes the photos. And there we have it. Asanteni sana. Prime Cabinet Secretary Musalia Mudavadi, our CS Aden Duale, Senator Jackson Mandago, our Chair for NCIK, Dr. Olweni, our CEO, Dr. Elias Meli, Governor for Kisumu, Professor Anyang' Nyong'o. As they get into the stage for another photo, one final photo with the protocols. Some can come down.
Chini sisi hapo. Mshika hapo chini.